Dear Dr. Bernstein and Naya, this is my presentation for my poster. The poster is titled An Innovative Community Geriatrics Curriculum for Family Medicine Residents. The authors, me, the other geriatrician, Dr. Anemiki, Dr. Neido, who is the program director, Dr. Wimmers and Dr. Montañez, who are the associate program directors, and Dr. Ramien Persani, who is the chair. We are affiliated with the Department of Family and Community Medicine, the University of Texas at San Antonio. The introduction: the U.S. population of adults aged 65 and older is increasing rapidly. Despite this demographic shift, the geriatric workforce remains insufficient. The Accreditation Council for Graduate Medical Education has established explicit expectations for geriatric care, with emphasis on longitudinal, competency-based education. A similar work was done by the American Geriatric Society and the Association of Directors of Geriatric Academic Programs, the ADGAP. However, the reviews of geriatric curricula for trainees of both specialties continue to show inconsistency in coverage, variable study qualities, and gaps in resident confidence and attitudes toward older adults. Integrating geriatrics into primary care resident clinics can improve attitudes and self-reported confidence, but these interventions are not universally implemented. Family medicine residencies, especially those serving high-need populations, require practical, scalable, and competency-aligned geriatric curricula that can be implemented even when geriatric faculty are limited, and that are aligned with the Institute of Healthcare Improvement, the American Geriatric Society 4M's principles that define age-friendly health systems. So the purpose of this poster is to describe the design, implementation, and early outcomes of a community geriatrics curriculum for family medicine residents of a large academic health center. This is by integrating competency frameworks, the Institute for Healthcare Improvement 4M's principle for age-friendly health systems, and a multimodal and community-based learning strategy. The settings and the participants: the curriculum was implemented in our urban family medicine residency program that is located in one of the lowest income zip codes in Texas, and it serves a largely older adult Hispanic population. For a total of 23,313 visits performed from November 1st, 2024 to October 30th, 2025, 8,038 were with patients aged more than 65 years old. The participants are 42 family medicine residents, 19 faculty, of which 2 only are board-certified geriatricians, and interprofessional colleagues. So what is the design and the evaluation? The curriculum is structured as a sequential multimodal program that integrates didactic foundations, continuity clinic integration, simulation and skill workshops, community and home-based experiences, and an embedded quality improvement project in geriatric medicine residency education. For the didactic foundation, monthly geriatric seminars, and emphasis on multimorbidity, functional assessment, cognitive disorders, fall, advanced care planning, and the prescribing. For the continuity clinic integration, embedding the 5 M's into routine family medicine continuity visits with an EPIC and MARC phrase that is aligns with the 4M's, 5M's frameworks, and a clinic level plan to study act that cycles focus on reliability, assessing, and acting on the 5M's. For the simulation and skill workshops, standardized patient encounters and interprofessional simulations. For the community and home-based experiences, structured visits to community senior centers, home health encounters, and collaboration with community agencies serving older adults. The early outcomes: a quantitative measure of implementation will be achieved by recording the utilization of the 5M's in continuing encounters with patients who are more than 65 years old. The residents and faculty members self-report in a sheet that is located at each one of our pods. A qualitative measure of implementation will be achieved by a yearly completion of a questionnaire self-reporting confidence in geriatric domains. These are also based on the 5Ms. And a system measure will be achieved by obtaining age-friendly health system recognition first and later designation by the Family Health Center. Implication for subprograms. This provides a turnkey framework that family medicine residencies can adopt to their context. It documents intent and eventually outcomes of institutional department program alignment with ACGME, AGS, ADCAB, and AHI, and offers a structure to generate measurable outcomes of the 5Ms completion. The references are located in the poster, and for the FAIR privacy compliance statement, all residents data presented are aggregated, de-identified, and used for educational quality improvement. No individual resident, learner, or educational record is identifiable in accordance with FERPA and an institutional policy, and patient-level examples are either composite or fully de-identified, consistent with HIPAA and local IRB guidance. For the next element, the dynamic learning element. A live poll audience response system. On the poster, we will include a QR code and a URL directed to a survey on SurveyMonkey with the following prompt and questions. The prompt: please answer the questions below. We will de-identify and process the answers received and send you an email with the data from the poll and the themes that emerge in the discussion. The polling questions: which type of setting you practice at, either an academic center, community health center, community hospital, urban or rural. How many physicians, mid-level practitioners, trainees in total are there in your group? How many geriatricians? And do you currently have a geriatric medicine teaching curriculum? And then in your current clinic, which one of the 5Ms are the most systematically addressed? And please share one thing you found work in your setting to improve the teaching and learning of geriatric medicine. How it's used: the participants scan the QR code or go to the URL on their phones and answer the poll, and a real-time bar chart on a tablet or laptop at the poster location is used to show the poll results. To launch a brief discussion that is recorded with the purpose of finding themes, with the ultimate goal of continued development of the curriculum. No institutional identifiers or learner-level data are collected from participants. Thank you.